Hey guys, happy Saturday morning. It's early here in San Diego. Usually it's nice and sunny, and I'm usually in the water surfing at this time in the morning at 7:22 a.m. But I woke up this morning and checked the cams, and it was all wind blown out, and didn't look like much fun to go out there and try to paddle around in some windy slops. So instead, I decided to come to the office and go through this podcast with you guys. So today we're going to go over why stretching your lower back may actually be making it worse. And so one of the biggest things that I see with patients is they come in and they have a history of having some lower back pain for maybe 3-4 weeks, 3-4 months, maybe even 3-4 years. And they've seen all kinds of physical therapists and chiropractors and massage therapists, and they have their whole routine, their stretching routine. And I understand it because I've had chronic lower back pain myself from some disc injuries, and I actually broke my back when I was 16. So I totally understand. Your back is tight, and when you stretch it, it feels good, right? And then it gets tight once again, and then you stretch it, and it feels good. So you go round and round this cycle. And today I want to talk about why maybe that cycle is not working the best for you, and maybe there's something different that needs to be done in order for you to kind of break that cycle, so to speak, and feel better. So the first thing we're going to go over, point number one, is not all back pain is the same. We have to understand, is the back pain actually coming from a disc? Is it coming from a muscle? Is there an injury there? Could it be some kind of a ligament? Could there be some other issue that's occurring? So we can't treat everybody the same and say, hey, well, I have back pain, so therefore I need to do these stretches and start searching on YouTube for what's the best stretch for me for my back pain. That is a crapshoot. Sometimes it could help, and sometimes it could actually just continue to worsen the condition for you. So that's a very common thing that we see here in the office. We have to look at, is there nerve irritation, right? In other words, do you have back pain plus some leg pain, some sciatica? That's going to be very different for maybe the type of therapy that person needs, and different stretches and or movements will help or hinder that person. So that's very, very important that we look at that. Also, some people are unstable, right? They're not very stable in their core, and I actually take x-rays on them, and we'll see on the actual x-ray itself from a side view, we take that x-ray, and as they start to bend forward, right, is that basically the bone won't stay stable. It starts to slide a little bit, and as it slides a little bit on there, right, that's going to create some instability, some nerve irritation, some disc irritation. So that needs to be handled very, very carefully. For example, that same patient, if that's happening as they're bending forward, and they say, well, when I bend forward, it actually helps and alleviates a little bit, that may not be the best stretch for that person, because they're actually creating more and more instability as they bend forward more and more and more. If we could have another patient that's very stable and they bend forward, and it really opens up their back, and maybe their pain really isn't a disc. Maybe it really is muscular. And for them, maybe doing some forward bends is going to make a big difference for them. So we really have to treat it as the back pain is individual. It's not the same. Kind of a similar analogy would be if someone said, hey, my arm is hurting. Well, there's all kinds of different exercises or therapy depending on what the source of that arm pain is. In other words, not everyone gets the same therapy for arm pain or the same exercises or rehab. So it has to be specific. It's not a one size fits all, okay? The tight feeling doesn't automatically mean that it needs to be stretched, right? Tightness happens all the time. I have patients come in all the time and their back is tight. And it's from the disc actually compressing. So there's 3 steps that occur typically with these disc issues. Is step 1 here is that disc compresses. Step 2, it pushes on that nerve root. And step 3, it sends a signal to those muscles to tighten. Those muscles are holding on for dear life. The muscles are actually trying to prevent it from further compressing and pushing into that nerve root. And so then the muscles get really, really tight. So in that scenario, if I'm overstretching that particular type of situation, it's just going to, quite frankly, piss it off and irritate it all the time. And you're just going to be stuck in this cycle over and over and over again. Now, I don't doubt that patients have relief when they stretch. I would get relief when I stretch too. And I was doing a lot of wrong things and different therapies and overstretching my back all the time. I was doing hot yoga like 3, 4, 5 days a week. I did that for a couple of years before I kind of figured out conceptually and really what I was doing. I was creating more and more irritation to my back. And once I stopped that over stretching and over movement and started creating more stability within my spine, it was an absolute game changer for me. So I completely understand why that happens. Now, the second thing is that there's a kind of two schools of thought, right? Some people go, hey, you can never, when you bend forward, no matter what, for everyone, that's really bad for you, that compresses your disc. And other people go, that will actually heal your disc. So it's very difficult. There's so much information. How do you know who is, correct in what they're telling you? And that's a very difficult thing. And it goes back to it's not a one size fits all. In other words, there may be a patient where bending forward is very therapeutically beneficial for them, and the other one, it could be the absolute worst thing in the world. Now, you have to kind of go through and see with each patient, what do they, actually analyze them, right? So in other words, you don't just give an exercise without actually evaluating that patient. And just because you evaluated them once, 3 months ago, doesn't mean it's the same thing when they come back in if they re-aggravated their back. Maybe there's a different reason for that back pain now. So there has to be mindful, thoughtful decision-making processes when we're going through this. A common thing that I see for a lot of people is that they're doing, we have a patient that had a huge massive disc herniation, and she's having radicular pain, meaning it's shooting down her leg, sciatica. She's barely able to sit for more than a couple of minutes. She can't, as soon as she bends forward, it starts to irritate. Well, the physical therapist is having her do toe touches because their school of thought was that, well, if she bends forward, it's just going to open up the disc area and that's going to help her. And she kept telling the therapist, hey, this isn't helping, it's making it worse. So as a practitioner, a therapist, we have to look at what's the best for our patients and listen to their body. Just because we gave somebody an exercise doesn't mean they have to keep doing it. If it's causing them pain and making their condition worse, right, we want to stop and slow down. And you as the patient also really look at that practitioner and ask them those questions. Hey, this is making my condition worse. What is there a different thing? Is this typical? Is this normal? For example, some patients in our office, they have a disc problem, and we go even very low weight. I might pull them at 40 or 50 pounds on decompression, which is very, very minimal, but it causes a little irritation because it stirs up a little bit of the inflammation. The muscles are really tight and they're getting a little stretched out. So there is some normal irritation that can happen, but just make sure you're asking whoever it is that's, has your programming of, is that normal or is it not, right? And also use your intuition. So, sometimes there's therapy that's just not appropriate for patients. And so you have to be thoughtful and mindful of that as well. Now, let's say, for example, that person has sciatica, and maybe it's into their glute only, right? That's all that it's going. And so then when they start to bend forward, right, that sciatica actually starts to come, it gets better. In other words, it centralizes. So for that person, they're compressed and they start bending forward. And as they bend forward, the pressure starts coming off the disc. That's great. That could be a very therapeutic, beneficial programming for them. But if you're bending forward and that pain is getting worse and it's traveling further down your leg, that's not a good sign. And that typically means it's getting larger, the disc is getting larger. So that would be kind of a practical scenario in which we need to make sure, again, we're being mindful and thoughtful what's happening. Point number 3, temporary relief doesn't always mean it's helping. There's something called a stretch reflex. So, you bang your elbow really hard, and what do? You rub it. Well, when you do that, you're basically kind of flooding your body, which is called your proprioceptors, and you're flooding that, and you're reducing what's they call the nociceptors, which is basically the pain fibers. And so that similar concept happens when we're stretching. It's called a stretch reflex. The muscles are very, very tight. And let's just go back to that patient that has the major sciatica, and her disc is really compressed. And when it's compressed, It's pushing on the nerve root. Sorry, I'm a little backwards here on the camera. It's pushing onto that nerve root. It's causing those muscles to really tighten. And so then she starts to stretch. Well, the muscles start to feel better. So she feels better because she's stretching out the muscles. But the problem is as she's stretching the muscles, it's further compressing the disc. So we, again, mindful and thoughtful with what we're doing in a program that makes sense for that individual patient and their condition, which also isn't static, meaning it should change as they're going through treatment protocols, right? We have patients all the time that come in, for example, maybe they're seeing the chiropractor and, they've been seeing the chiropractor 3 times a week for, sometimes 4 or 5 months. And, that's not the patient's fault. The chiropractor at that point, in my opinion, 3-4 visits if there's not some fairly substantial relief for many conditions, it's probably not appropriate. And at least some, 10, 20, 30%, that kind of thing. At max, maybe a couple of weeks of treatment, and there should be some changes for sure happening. That's the way that we do it here in the office, and we're dealing with severe disc issues. So again, mindful and thoughtful in a plan and some goals, and if those goals aren't met, then hey, what's next? What are we going to do, rather than just more of something that's not working, right? Movement can temporarily change the pain. So if you're seated, for example, right, and you get up off of the chair, well, sometimes that will help to reduce the back pain, right? There's a reason why patients in hospitals get bed sores. They can't lay down in one position for so long. You have to have movement, right? So the movement helps to loosen up. We want to make sure we're moving. I'm not saying don't move. Of course, we have to move, but we don't want to. There's a fine balance of overly stretching and moving and stretching and stretching and stretching when we're dealing with disc injuries. Now, again, we have to have a proper assessment. Some patients come in and they think they have a disc injury, and they don't. I assess them, and actually they have a facet joint that's maybe locked on up. We had a patient that happened on Thursday. His issue was not a disc issue. He had a facet joint that was locked up. He couldn't turn his neck very well. He had some tight muscles. He had true muscle tightening, which needed to be addressed. So in his case, we did not do any decompression with him because it was unnecessary and not needed for him whatsoever. So we really got to look at making sure that the programming makes sense and that there is some both long-term as well as some short-term goals with this. And if it's not showing, the data is not showing it's moving in the right direction, then we need to switch something up. But we can't continue to do the same thing over and over and over again, right? We want to individualize the treatment as much as we can. Now, obviously, there's some generalizations that happens. That being said, different body types need different treatments, right? So I'm 6'2". I fluctuate between 200 to 210 pounds. If I'm treating someone similar to my size, and someone else comes in and they're maybe 5'8", and they weigh 210 pounds, my build is a little lot more lean. I'm not super skinny. I'm not super muscular. I'm kind of a mid-range. My point is that we have to treat people individually, even within the same treatment protocols or programming. For example, if I'm decompressing 2 patients and one is more thin and wiry and one is more stocky, that stocky person, I know in my mind they're going to need more weight because their discs are bigger, stronger, and they're able to bear a lot more compressive forces, which means they're going to probably need more decompressive forces. The bendy, wiry guy, he's not going to need much force, and if I apply too much force into that person, he's probably not going to feel great. They also ask me, hey, once I'm better, I want to go back to the gym, or I want to do this activity or what activity. Well, if the thin, wiry person is wanting to, do a bunch of back squats and they have an L5-S1 disc herniation that we've been able to fix and heal, back squatting may be the worst thing in the world for that person. Maybe doing some goblet squats or maybe doing some single leg, anterior or posterior lunges may be significantly better for him because he's not able to bear that weight all that well, right? Think of that kind of thin, willowy branch. A willow branch bends all over the place, super bendable. Can't, bear it any weight to save its life. A redwood tree can't bend to save its life, but can bear all kinds of weight. So it's not a one size fits all. Now, that willowy person that's real thick and thick trunk, they may squat till the cows come home and have no issue whatsoever. And that may feel great for them. So again, it's not just in-house treatment and in-house programming. What you're doing outside of whatever therapy you're getting is crucial. And if you don't have someone to guide you through that and give you the right things to do, and most importantly as well, what not to do, you're up. It's what we call push and rope. It's a hard, tough battle, and you may want to consider getting some help on a practitioner that would be more thorough in their programming. Okay, really understanding why the pain is there is our last point. And if you don't have a good history, a good thorough examination, we don't have proper diagnostic testing, which again, this has to be individual for everybody, right? A ton of patients we come in here and they may have seen, my average patient usually has seen probably at least 4 to 5, maybe 6 other practitioners, right? Before they come to see us. And a lot of that is they were misdiagnosed. Maybe they went to their medical doctor. We had a patient not too long ago, she was having horrible leg pain, and they were x-raying her knee, her leg, her hip. They did, I think, ultrasounds. All kinds of stuff. To me, it was classic disc compression. I mean, I didn't need an MRI, but we ordered an MRI because she was able to get one, and she had a little bit of irritation, and every once in a while, a little bit of numbness into the groin area. It wasn't constant and consistent. If you have that, that's typically a red flag. But she had enough that I really, in her case, wanted to get that MRI. And the MRI came back, and sure enough, the disc, it's extruded. I want to say it was like a 13 or 14 millimeter extrusion, which is fairly large. It's pushing directly on her L5-S1 nerve root, and this is why she's having that right radicular pain in her lower back, in her glute, all the way down her leg. The poor girl, she had this thing for 6 or 7 months before she came in and got the MRI. Long story short, we decompressed her, we rehabbed her, and we got her back to working out, but definitely modified how she worked out, and she's doing great. She's, avoided the surgery, didn't have to go through surgery, all the rest of that stuff. So you've got to really look at each person and each patient in a very specific manner. What do they need? And if you're the patient, make sure that the practitioner is looking at that, right? You shouldn't have every single patient that the person sees has the same exact thing, because that's just not true. Number one. And number two, even within that, there's different parameters that need to take place, okay? In our office, if anyone's actually doing decompression, we go through flexion, what's called flexion extension x-rays first. Their spine has to be stable, okay? In other words, if we're looking from a side view here, and we take an x-ray, and we have them bend forward and bend backwards, those bones should be tipping and never slipping or sliding. If they slip or slide, this is spinal instability. And if we have that, I don't want to create more instability by trying to pull apart, and in many cases that will irritate that particular patient. Now, if it's a couple of millimeters, it's probably not a big deal, but if it's 7 or 8 or 9 millimeters, it's a fairly substantial thing. So that would be an example to make sure that we're being thorough with our diagnosis. Now, some patients come on in, they need MRIs, absolutely, because there's some red flags, but I don't routinely send someone out for an MRI unless we see that there's actually clinical relevance to that. In other words, if I have a very good history of working diagnosis, x-rays, I know what's going on, we start treatment, within 2 weeks they're 50% better, I don't need to get an MRI. Now, if in those 2 weeks they're getting worse, I'm going to get an MRI at that point to get some additional information. So we kind of like to treat people and not MRI reports. In other words, we don't look at an MRI report and just say, hey, you have this, therefore that. Because there's been patients that have come in here and they, for example, had horrible neck pain, and their doctor, for whatever reason, ordered a neck and a lumbar MRI, and they have this huge disc herniation in the lumbar MRI and their lower back. They have zero lower back pain whatsoever, right? And then they ask them about it. They go, oh, yeah, you know what? 10 years ago, I threw my back out doing a bunch of gardening and some yard work, and it was horrible. And then it kind of went away, and I don't have any pain now. But the MRI in a static position with them laying on their back, it's compressed. But when they weight bear and move, it's non-clinical. It's not causing those symptoms. So this is just another example of making sure that we're understanding the patient, we're being specific. So if you're seeing somebody and they don't have a solid plan for you, and or you have questions and they don't allow you to ask those questions, or when you ask them, they have answers that seem very vague and not very, I guess, clinically relevant and don't make sense to you, use your intuition, but push that a little bit. You got to advocate for yourself, okay? And if you need some help and you're not getting the treatment that you need, or you're not seeing results, you're welcome to call the office. You can call here at 619-298-0800, and I'm more than happy to try to help you and see if there's anything that I can do. And if I can help, hey, I'm all for it. And if I can't, I have a network of other doctors that I can send you to, and I'll let you know what's happening. So hope this helps. I'm hoping that the surf picks up, but I don't think it will today. But we'll see you guys next time. Have a great day.